All right, everybody, this is a video on Hims and Hers Health. I just want to show you my thoughts on the company, where I think it's going. Just for transparency, I've been invested in the stock since around $7. Um, it's an incredibly volatile and risky stock, but I believe there's a lot of opportunity here. I believe there's a secular change coming to healthcare, and there's a few companies that are offering an opportunity for patients and for investors to benefit from that. So we're just going to start on the main page here. HIMS is not just a telehealth company. They have a pharmaceutical manufacturing license, but they also, I believe they're trying to encompass all that you can do as a patient through a single app, and a single touch point. They go over sexual health, testosterone, labs, hair health, mental health, weight loss, news. Um, and the news section is actually interesting. You could just click on this and see all the crazy things that they're working on. They provide total health. They give you recipes for complete diabetic patients, patients that need to avoid certain types of fats. Um, a new segment that I believe is being slept on is they're partnering with Quest Diagnostics to offer labs. I believe I am a nurse manager. I've been in healthcare for 15 years. I believe that healthcare is a little broken in our country, unfortunately, and I'm seeing some patients are going to Hims and Hers to find a cheaper way to get what they need without utilizing insurance. So they're paying for a subscription service. They might be getting mental health medications, or a woman going through menopause getting some new medications coming down the line. They're able to meet with physicians online. Soon, I believe they'll be able to get sort of a full evaluation at home. And to me, it's a little bit sad that you pay thousands and thousands of dollars for health insurance, and you might be able to just use an app like this and pay a subscription that's totally bypassing the system. But here we are. What are you going to do about it, right? Um, so long term, I believe they're going to become a massive data company. They're going to collect all of their customers' data, and they're going to analyze it and see, health trends between races and sexes and locations. And they'll be able to use this to help other companies, including themselves, um, give patients the best care that they can that can be provided to them in this modern age. Um, Jumping right into the financials, this is their Q3 2025 highlights. 49% growth to revenue is huge. Net income is massive. Their cash flows have always been massive, and normally I'm looking mostly at operating cash flow for this company. And their subscriber growth is huge, and something that I think is important to focus on for this company is the monthly online revenue per subscriber. Um, this took a little kickback over the last quarter or two, but $80 per subscriber. This is definitely not a normal telehealth company. When you compare some straight up telehealth companies, their revenue per subscriber's a few dollars if they're lucky. So they're clearly able to capture a lot of gross margin from their strategy. Um, if you're looking here, what you see is people who are going on HIMS are paying money. They're not just subscribers, they're paying money. So there's personalized versus non-personalized plans. And this is where we get into the GLP drama. Hims argues that personalization is a way for patients to get a customized dose for GLPs, and the reports are that these patients have less side effects and they're less likely to stop taking the medication because the doses are customized to their needs based on their comorbidities and other factors. So I believe, as someone who's been in healthcare for 15 years, this is a great thing to offer to patients, and I don't believe that the FDA or other governing bodies are going to get rid of this because there's going to be patients that say that they are having a better experience with a customized dose, and I believe Novo Nordisk and LLY and friends are on the same page about this, whether they like to admit that, because if they were really so worried about it, they would have already sued Hims. But my theory is they're going to be like Uber with robo-taxis, where people are going to flock to their service. Um, I believe that Hims and Hers companies are going to start to flock to them to try to boost their volume because they clearly have found a way to get users on the platform. The users are enjoying the platform. They're keeping a lot of the users and they're gaining traction over time. So I'm actually not using Stock Unlock today. I'm trying Qualtrim, which is Joseph Carlson's platform. I do like it. It's a little different, but I think he views the market the same way that I do. Um, and he's really a cash flow guy like I am. So here we are. So one way to look at the valuation for this company would be using a free cash flow multiple. You will see that there's a massive stock-based compensation impact, and that's because, a small growth stock like this, they're trying to get the best talent, especially physician leaders. So I plugged in a couple numbers here just to sort of show you, you know, what would that free cash flow growth be and what would the multiple be to project what I'm looking at here. And this is more of a bearish case for 2030. We're getting about a $94 share price, which I know we already hit 75 recently, and then we went back down. But that's actually a massive growth from here. Um, and this is just what I want you to realize is their free cash flow is suppressed because they're spending a lot of money on advertisements. There's a lot of stock-based compensation going on. So at any point in time, as their free cash flow grows, um, they're going to actually, these numbers are going to change drastically. So let's look at the company. Let's check out Qualtrim. Um, I like the colors of the graphs and everything. Look at this huge growth rate to revenue. Like, this is something I'm always looking at. I don't really like to look at companies that don't have revenue growth like this. Total subscribers, huge growth. You know, monthly average revenue per subscriber. We had a little dip, but look at this. Absolutely bananas. I don't really want to focus on net income here. They're suppressing it on purpose. Free cash flow is a little bit helpful. But even, even with these dips here because of GLP drama, with the 2-year compounded annual growth rate is 121%, which is great. Um, you know, they have debt, but that's okay. They didn't have debt until recently. They're clearly doing this for a reason. And if you want to take a snapshot of their expenses, this is going to show you what I'm talking about. So, you know, it's a decent amount of expenses here. Uh, I do like the colors on Qualtrim, I'm not going to lie. But anyhow, another thing that we can do to evaluate this company is look at their own guidance and their CEO. He reminds me a lot of like Sophie, however you want to pronounce it. CEO, he likes to under project what he believes is going to happen in the future. So 6.5 is probably his bear case for 2030. That's a huge growth from now. That's over a 3x revenue growth. We're going to ignore this for now. Women's Health, I believe they stated in the earnings report that they're aiming for $1 billion revenue from just that segment in the near future. So that could be a real game changer. And I really believe there's a market for women suffering from menopause symptoms and the discomfort that comes with that. Um, so what I did here was we can definitely look at Model 1, which is an earnings model. I'm not a massive fan of an earnings model for this company that has over a 50 PE right now. But if you were to take that adjusted number and make it even more bearish and cut the multiple in half, you'd get a $37 billion market cap. We're currently sitting at a $7 billion market cap, so it's a massive growth. What we're looking at here with Gemini helping me out is $6.5 billion revenue and a spread of a price to sales of a 4 and an 8. So you're getting a $26 billion market cap or a $52 billion market cap. Let's go to our buddy Qualtrim here. So if we're looking at 26 divided by talking a 3.4 multiplier on the current price, and then 52 divided by 7.61. It's like a 600% share price increase from now. Obviously, a lot needs to play out for this to happen, but that's been my general thesis. I believe that this company, the CEO is very smart, the leadership team is smart. I work with a lot of physicians. They don't trust Amazon. I know people keep mentioning Amazon. They're more likely to work for this company than for Amazon, and they're getting a lot of key talent. And I really believe the women's health segment and just women customers in general is a huge market. Um, and I like the idea that once you get a customer, you can start following up on them, getting labs drawn. You can glean a lot of information from that and possibly prescribe cholesterol meds and other things in the future based on that. And it's cheaper than using insurance, which is crazy to me. Um, so anyhow, that's how I view this company. I try to keep the video short. I could certainly go into the drama of the news. I try to stay out of news-based events and macro drama as much as possible when I'm investing. I'm mostly looking at cash flows, and I'm trying to not get sold a story, but to do the best I can to look into what problems companies are solving for the markets and go from there. So I hope that was helpful. Thank you.